cows can be kind of show less symptoms, as I suppose early signs on a farm could be maybe just milk production losses and infertility issues and maybe early embryonic loss, I suppose, would be some things you might see. And if it was happening on a large scale on the farm, I suppose it could be a red alert, like.
Are you concerned about the recent spread of Bluetongue virus? Join me as veterinary surgeon Patrick Duff cuts through the noise to deliver the essential facts you need to protect your livestock and understand this complex disease. So hi Patrick, you're very welcome to the show. Can you tell me a little bit about what Bluetongue is?
Yeah, so Bluetongue is a virus. Bluetongue virus is the name of it. I suppose the main way it's transmitted is through biting midges. And it can also once the cow has it, it can be transferred to the calf potentially if she was pregnant as well. I suppose in terms of symptoms, there can be severe clinical signs and more high mortality rates, especially in sheep, but cows can even be a little bit asymptomatic as well. But in terms of the clinical signs, I suppose it'd be kind of drop in milk yield, fever, drooling, kind of ulcers in the mouth, even on the feet as well, swelling of the tongue, that can also cause then difficulty breathing, and obviously, yeah, serious mortality rates and production losses for farmers.
So it's a very physical looking virus
Yeah,
as well.
generally speaking, now the cows can be kind of show less symptoms, as I suppose early signs on a farm could be maybe just milk production losses and infertility issues and maybe early embryonic loss, I suppose, will be some things you might see. And if it was happening on a large scale on the farm, I suppose it could be a red alert, like.
I think farmers now at the moment will have to be vigilant and just really, really look out for whatever is on the farm. But like,
Yeah.
what are the real pinpoint signs? It's more pinpointable in sheep to start with rather than cattle, isn't it?
Yeah, like it hasn't been discovered yet in sheep in up in Bangor where it was found at the moment. I suppose it's only been found in cattle, but I'd say the problem is there. The cattle can be kind of not showing many symptoms, so it could have happened a few months before it was actually found, if you know what I mean. So I suppose they mightn't gain as much weight, and low milk yield would be kind of the early signs, and infertility issues, I suppose, depending on the season. I suppose in some ways we're lucky that it happened this time of year, because if it was in the peak time, it'd be very, very hard to control the midges. I suppose we'd have to get protocols in place in terms of spot-ons and even housing animals at dawn and dusk and that type of thing to where the midges would be kind of most prominent, I suppose, you know.
So it's a midge that causes it to start off with.
Yeah, so the midge would be the vector, so that's the main way it would transmit to animals. They can't actually transmit between each other, I suppose, potentially it through semen, I suppose, if you had a bull out with the cows or something like that, again, on the time of year, but potentially through blood as well. So I suppose not using the same needles and that if you were vaccinating cattle would be another thing to kind of watch out for. I suppose it'd be slightly rare, but the midges would be the main source of transmission, I suppose, you know.
So if it's in Bangor at the moment and that's kind of a restricted zone, um, because there's very little midge activity, say between October and March or April of next year, it could potentially be quite controllable, could it? Or is there
Yeah, you'd
still
be
the
hoping so.
potential?
Yeah, I suppose you'd be hoping so. That we will be able to control it. Just the fact the season, I suppose, the midgets mightn't be as active. Like they say that the midgets can't really spread it once it kind of goes once it goes under 12 degrees, I suppose. So you'd be hoping that the midget activity will be lower this time of year, so that once they have their control zone in place now in their blood tests and they're finding the positives, that it mightn't come back. But again, I suppose farmers, especially up in that area, and even ourselves, we have to be hyper vigilant and I suppose take every precaution, I suppose, to try and reduce kind of where midgets could be active, I suppose, taking away any kind of damp kind of puddles and mucky areas and that type of thing, and even maybe possibly even using midget-proof vents if there was feasible for farmers, and having plenty of ventilation in the sheds because they hate wind as well, do you know, that kind of way.
Well, good to know. Um, do they affect okay, so you have your cattle and your sheep, and what other animals could they potentially affect?
Yeah, so it can also spread to deers, sheep, goats, and camelids like alpacas and llamas as well. So obviously that's another, I suppose, risk as well, that if it gets into the wildlife, it could be very, very hard to control, you know, especially the
Mm.
deer population is that's quite big in Ireland at the moment as well, you know.
Okay. And would my current vaccination program on my farm, would that cover me for the specific types of stereotypes active in our region? Would that?
I suppose I think with Bluetongue there's 24 serotypes and the vaccine is serotype specific. So the one that's been found in Northern Ireland at the moment is serotype type 3, I think. And that serotype, unfortunately, there is a vaccine for it, but it's relatively new, I think, as far as I know. So they don't actually know how long it actually lasts. And the other side of it is I suppose it has to be regulated by the government to be allowed to use it as well. So it's not something that we have available to us right now. So it all depends. I suppose they're trying their best to keep it out of the country. Trying to stop people from importing as much as they can. I think they're even saying if people did import animals and they were found positive that they wouldn't be compensated for them. So I suppose that's a deterrent for farmers not to try and import semen or any animals across from any high risk countries, I suppose.
So some of it at the moment is in our hands. If we import,
Yeah,
we have to be
definitely. Yeah.
vigilant.
Exactly. I suppose just farmers being transparent with each other if they are buying and selling cattle, knowing where they came from and all that will definitely be a help. So that they can quarantine animals or even get them tested just to be on the safe side, I suppose,
And what's the test, Patrick, for animals
So
coming into the country?
the test is an RT-PCR test for the live virus. That's kind of the most accurate way, and that's what to be implemented in any of the control zones if there is a suspect case found. I suppose the biggest thing is if you do see any of them signs, ulcers in the mouth, kind of swell tongue, or ulcers on the feet, or anything unusual like that, high fevers, red eyes, kind of crusty noses, anything like that at all, or weird milk troughs in the cows, like unusual 20% drop or 50% drop out of nowhere. I suppose it'd be difficult to find now when they're being dried off,
Oh,
but
yeah,
even
just at
going
this
into
time
the
of the year.
spring, I suppose, looking out for these signs, low weight gain, all that type of thing, to be able to notify it if it's something that seems out of the blue, I suppose. That's the biggest thing, so we can
And
get on top
would
of it
would you
quickly.
not would you notify your local DVO or do you go straight to the?
I think yeah, it's the local DVO, the regional veterinary laboratories. I think there's also a kind of a hotline, as far as I know, that you can ring even out of hours. That they'd have available on the department website. If there was something that you were very concerned about.
Okay, so what are the risks, say, of using the live attenuated vaccines compared to the inactive ones? Are there any
Um,
risks or
yeah, I suppose
complications?
in most cases when you're doing vaccination programs in Ireland, the live ones are very good, but I suppose because of the type of virus that Bluetongue is, the inactivated ones are more preferable because there is a chance that the live virus could actually there's cross placental damage to the calf, so it could potentially infect the calf. The cow themselves, when you give them the live virus, they could potentially actually get sick from it as well, and also the midges when they bite an animal that has been vaccinated with the live virus, it could potentially spread it to other cattle. Although it probably would be unusual and rare, but that's why they kind of prefer the inactivated ones because there's no chance of that happening. Like,
So they like a particular kind of environment, these midges. Is there anything that farmers could do in terms of midge proofing their facilities?
I suppose they can get major proof kind of vents in their ventilated areas of the shed. I suppose having plenty of air going through the sheds obviously will lessen the risk as well. And even having it very well drained, I suppose, and taking out any wet, damp feces and dung. And I suppose they love that kind of environment and the bit of heat as well, like, and stuffy sheds, they'd like that. So if you can avoid those kind of things in your sheds, and I suppose in the summertime going forward, I suppose for control measures, even bringing it, they might even have to go to the point of bringing animals in at dawn and dusk as well to prevent any chance of midges biting them in high risk periods of the day, and even implementing spot-ons like veterinary approved spot-ons as well, kind of on a monthly basis, I suppose, to prevent midges wanting to bite the cattle, I suppose, to slow the spread down.
And how long does it take from the time, say, that they get bitten by the midge to actually develop the virus?
The virus. Again, it depends on the temperature, but it can vary. Once the midget bites the infected cow, it could take between 4 and 20 days for the midget to actually spread the virus, I suppose. So obviously in warmer temperatures, it could be as low as 4 days, but in kind of cooler temperatures in November and October, maybe it might be nearly closer to 3 weeks, like.
And for farmers now at this time of the year that have pregnant lambs infected with blue tongue, are there any chances that, say, the calf or the lamb will be affected by the virus?
Yeah, so again, I suppose it depends on the serotype that we have or the stage of when the animal was infected. So I suppose in early stages it could cause early embryonic loss, abortions, maybe mid-pregnancy, maybe later on in pregnancy, then it could cause deformities even in calves, depending on the serotype. Or even it could have a normal calf or a weak calf that could potentially be infected, and again, if a midget bites it, it could spread it on again, you know.
Okay. Is it safe to use semen from the bulls and rams without
Um,
testing it during the outbreak?
Yeah, I suppose they'd be definitely the government would be advised not to import any semen anyway, especially from risk countries like the UK and other European countries like the Netherlands and Belgium and places like that. Just going for like kind of certified approved semen that has been tested for blue tongue, I suppose, and other diseases that would be notifiable, I suppose.
Yeah, again,
Um,
there's a responsibility on the farmers to
yeah,
be
like the AI
vigilant.
stations, to be fair, in Ireland, to be very stringent on
They
their
are,
their
yeah.
blood testing protocols. Like for anyone that is taking semen and semen sample, or if you're using your own semen, they would make you go through all the blood tests, I suppose. So just making sure it's certified is the biggest thing.
And another thing I suppose is just to reiterate is that there's no threat to public health with this as well. Sure, there isn't.
Yeah, exactly. Like I suppose it'll be very hard financially on the farmer, but in some ways it's not zoonotic, so it can't spread to it's not zoonotic and it can't spread to humans. And it's obviously it's okay in the food for food safety point of view, it's okay, you know. But it's just the implications, the losses on farmers, the potential mortality rates, production, milk production losses, beef production losses, and trade issues, I suppose. Like it could potentially disrupt our exports of cattle, which has been going so well in Ireland this year. I suppose we had such an exceptional
Exactly.
year for the beef farmers.
Yeah.
That this could potentially bring it right down. So I suppose just everyone needs to work together to
Mm.
keep it down and be honest with each other and that kind of thing, you know.
It has the potential to derail, so we do need to be vigilant.
Yeah.
Patrick, if you get an outbreak, okay, is there any chance of curing, say, the sheep or curing the animals once they're infected?
Yeah, like there is a high mortality rate with it, obviously, but like some animals can be asymptomatic as well and could be fine. But I think they do have it for life, I suppose. But you definitely can treat the symptoms and they can develop their own antibodies for it. Or also, if you know we did have a bad outbreak, they probably would bring in the vaccine, I suppose, which would help protect them as well.
Yeah, so yeah, okay. And then are there specific times of the year or weather conditions when you should be on high alert?
Yeah, I suppose the peak time for midget activity would be late April to, I suppose, mid-August when the weather's warmer and that. That would be the kind of the peak time, but they still could be potentially active up even to late November, like, you know. So I
Okay, so
suppose you want to be on high alert in those times, and potentially if it did come into the country, they probably would be advised for people even to bring animals in at the risk period times, as we were saying.
okay. And then if you have a suspected infection on your farm, what test can you use to get the quickest confirmation?
Yeah, so I suppose if you did have a suspect case, to do the RT-PCR test would be the most accurate way of diagnosing it. I suppose in Ireland they have some information up of what they're planning to do if it did come in. I suppose they'd probably put a temporary control zone over whatever farm was infected up to 150-kilometer kind of minimum radius, and within that zone, then there'll be blood testing farms, nearby farms, with that RT-PCR test to see if they have any antigen present. And I suppose animals would be probably removed and slaughtered then if any were positives were found. And they'd probably implement control measures in terms of spot-ons and housing the animals as well and keeping low damp areas and well ventilated sheds.
And then in terms of if you have a confirmed case on your farm, how will that affect your ability to sell or to move the wild
Yeah,
stock
it's like obviously
within your farm?
there will be movement restrictions as well. I think more than likely they'll only be allowed to go to the slaughterhouses with animals. They wouldn't be allowed to sell or buy in. So they'll be only going straight to that slaughterhouse that would be approved, had to be approved first before they even do that, I suppose. And I'm sure the factories would probably be notified as well and they'd be on high alert looking for any sort of potential symptoms.
So at the moment, we're really hoping that in Northern Ireland and in the UK that they're being very, very vigilant that there's no movement of stock
Yeah,
Or there's
exactly. Yeah.
controlled movement of stock.
Yeah, like I think in Bangor at the moment they have a 20-kilometer radius around the infected farm. I think possibly they've been doing blood testing on that farm, and there has been a few more suspect cases confirmed, and even a neighbouring farm has had two beef cattle confirmed as well. So they're doing their best to get on top of it, I suppose, and they've restricted movements in all those areas for the moment. So hopefully what they're doing is working, you know.
Yeah, so following a good year for beef, that now we could
Yeah, I know
potentially, yeah, it's so worrying for farmers, really, isn't
it
it?
is, yeah, yeah, yeah.
The
It's just,
unknown and it's uncontrollable, especially like I've
yeah,
just done a podcast with Rebecca Tierney on bird flu, and again, like it's very difficult to control it because midgets fly from one country to another. They're taken in the
that's
wind from
it.
one
Yeah,
country
they
to
like
another.
they can be brought over by the wind even, you know. I suppose we've been lucky in some ways that most of our wind is southwesterly, and maybe that's why Bangor got affected from the east winds, maybe from where
Yeah.
it's located, I suppose. So that could still be a help to us to keep it out. But we do all have to kind of be hyper vigilant and take appropriate measures, I suppose, you know, to minimize it, and even maybe avoiding I suppose marts in some ways, even kind of trying to buy privately within local areas, maybe to
Mhm.
that you'd have no risk of any potential imported cattle mixing with animals and stuff that could be bringing in midgets with them. Like,
Well, thank you, Patrick, for all your insight and guidance and on this potentially formidable virus. And thanks for joining me on the show.
oh, geez, no worries here. Thanks very much for having me anyway.
You've been listening to the Teagasc Environment Edge podcast, signpost to farm sustainability. For links, tools, and the latest research, head to teagasc.ie and search the Environment Edge. Thanks for listening, and join me, Deirdre Glenn, next time.